In a statement today, Regional Health Officer of the Upper Demerara Berbice region, Dr. Pansy Armstrong, disclosed that another COVID-19 case was recorded. This now brings Region 10 total number of COVID-19 cases to 10, including one death in early April. Of the existing cases, there are 2 more recoveries, taking the region's recoveries now up to 3. Meanwhile, the Public Health Ministry's COVID-19 update today was done by Deputy Chief Medical Officer Dr. Karen Gordon-Boyle. She disclosed that there have been no new cases recorded for the 3rd day running this week.
As of today, of the 27 tests done, there are no new cases. Our COVID-19 deaths remain at 12, and the number of confirmed cases, 153. To date, the total number of persons tested is 1,699, with the total number of negative cases being 1,546. We currently have 70 persons that have recovered.
According to the DCMO, there are still 2 patients in the COVID-19 intensive care unit, ICU. Meanwhile, she added that 71 active cases are currently in institutional isolation and another 25 persons in institutional quarantine. Dr. Boyle went on to explain the difference between isolation and quarantine.
Everyone who receives a positive test result will be placed in isolation. Persons in quarantine are those persons who were in very close contact with someone who tested positive, persons returning to Guyana, and someone who is suspected case awaiting results to confirm his or her status. The duration of someone's stay in isolation is not fixed. It depends on how fast the body fights off the virus. All persons in isolation are cleared after having 2 negative tests 24 hours apart. Persons who are cleared and allowed to go home are not infectious, which simply means that they cannot transmit the virus to anyone else because the virus is no longer active in their body. With that, we ask that you show some compassion to your brothers and sisters who have recovered from this disease. Their journey was not an easy one, and they need your support.
Reporting for the Evening News, Banu Manik Chand.